The plan shifts in Phase B and further in Phase C, where our focus is on managing hospitalisation, serious illness and, of course, avoiding those fatalities. So those outbreak scenarios which Doherty have modelled indicate that when you get to that 80%, and I stress that 80% with sensible living with COVID precautions, then you are dealing with a scenario that's not unlike living with an infectious disease like the flu. So there will always be infectious diseases resulting in hospitalisation and indeed in death. That is something that happens sadly each and every day, but that's the world in which you live, and I think Australians understand that. But it does enable us, when we get to Phase B, and especially in Phase C, to move away from that being the focus. And what we are then looking at very carefully are those other matters. But Paul and Jody?
So I think it's a really key point that we've made here on several occasions. We have at the moment a national strategy which has been devised through the AHPPC and endorsed by National Cabinet of suppression with no community transmission. That is our strategy at the moment, and there are two reasons why we have that. The first one is to minimise that transmission in the community so that we don't have those severe illness outcomes and to therefore minimise those hospitalisations, ICU and deaths. We've seen what's happening right now in Sydney in relation to that increasing number of ICU admissions, the increasing number of hospitalisations and, very tragically, those increasing numbers, those small, of deaths, mostly in unvaccinated people. We need to move with that four-phase plan to a different phase. We need to accept that there will be cases. We need to accept that there will be hospitalisations. There will be ICU admissions and there will be deaths. So we do need to go back to that original suppression strategy that we had at the beginning of the pandemic last year, which was based on coping with that, as well as minimising those numbers. And so we need to revisit those plans of capacity and intensive care in hospital capacity, as well as continuing to have, and this is very clear from the modelling, the very best testing, tracing, isolation and quarantine elements of our public health response.
Thanks, Paul. And just to reiterate, slide 10 is the most important answer to your question here. So all of these other figures about thousands of deaths and so on are configured on allowing cases to escalate, losing some measure of public health response capacity and having only baseline restrictions. So slide 10 indicates if we can keep some social measures on, if we can maintain that public health capacity and if we can allow the synergy of those interventions to work together, then we can potentially reduce adverse outcomes 100-fold. And that's the really critical message, is that as before, there is no one thing to do. If all of those things are combined and the population can come on board and we can keep those behaviours, the population's been amazing in really cooperating with the COVID restrictions, and they've seen the benefits of that. This is best for health, and as Treasury's told us, it's also best for the economy to keep case numbers low through these combined strategies. Thank you.
It took 10 years from 2007 to 2017 to get from the 70% vaccination rate to the 80% vaccination rate with the HPV vaccine. What makes you think, when other countries like the US and the UK, who have had longer vaccination rates or longer vaccination programs than our own, what makes you think Australia is any different? And will you consider, or if you won't, why won't you consider giving Australians cash incentives for vaccinations?
Well, first of all, Australians understand the challenge. Australians want to get on this path so we can live with this virus and they can return to a life they knew as far as possible. This is a very different public health challenge to what we've seen before, simply because of its scale. It's a 1 in a 100-year pandemic. It is a pandemic that reaches the entire population and has imposed very significant restrictions right across the country with very severe economic consequences, both lives and livelihoods lost. So I think Australians are in no doubt about the seriousness of this public health crisis and how every single Australian has a role to play in ensuring that we can get this plan implemented and we can get Australia vaccinated. And General Fruin and his team have been working tirelessly to ensure that both the suppliers, the points of presence, the GPs, the pharmacists, all of these things are working to ensure that we can meet those targets and get Australia to where we want to be. Now, we have always been led and informed by the evidence and the clear expert health and economic advice. And I stress health and economic advice. All through this crisis, over the last more than 18 months, the Treasurer and I, the Health Minister, the Cabinet, have sought to understand the challenges that are both health and economic. That's why I've always said saving lives, saving livelihoods. And I stress again that Australia has achieved on this front like few other countries in the world today. And we will be able to get Australia to a point that we will be able to add vaccinated to that list. Now, I have great faith in Australians to do that. As General Fruin has indicated, his team have looked at the incentives and his conclusion he's already outlined to you. I think the proposal that has been put forward by the Labor Party and Mr Albanese is a vote of no confidence in Australians. It says to them that their health concerns that they might have about a vaccine can be paid off. And I don't think that's the view of Australians. I've seen Australians respond with courage, determination and kindness over the past 18 months to get through. Doing it for the cash, I don't think, is what would motivate an Australian to do this. I think doing it for themselves, their family, their communities and for their country is what motivates them to do this. And so sure, you know, it's a bubble without a thought. Sure, it demonstrates, I think, a lack of considering the real evidence here and informing themselves in terms of a path they're going on and understanding the unique Australian characteristics. Carbon copying a plan from another place doesn't necessarily work in Australia, particularly in a country that has a very strong record on vaccination and not appreciating that. I mean, just think about it. We've got almost 80% of over 70-year-olds. Didn't have to pay them. They understood its importance. They've gone and done it. About 2/3 of those over 50 have done the same. They were the populations that have had the greatest opportunity to go and do this. Do we really think that Australians of younger ages are less committed to their own health, the health of their families, the health of their communities than those who are older? Of course not. Our plan is backing in Australians. It always has. Backing them in with the economic supports to get through the crisis, backing them in on their values and their commitment. This is a serious public health crisis. It's not a game show. And it's very important that we continue to respect how Australians are engaging with this process. So if they do have hesitancy about vaccines, I'm not going to pay them off. I'm going to pay a GP to sit down with them and talk them through their concerns, which is what I have already done, because that's how you can alleviate their concerns. I'm going to say to them that if you're vaccinated, then you present a lower public health risk to the rest of the population, and therefore it's only common sense that you could be exempted from certain other restrictions that might have to be placed on others for their own protection because they're unvaccinated. That's the scientific approach. That's the approach that we're taking. That's the clear evidence-based plan that we're taking, not a thought bubble minus the thought. Yep.
The National Cabinet's agreed in principle to easing restrictions and the severity of lockdowns once we get to 70 and 80%, but how can you be so certain that they will stick to that plan once we get to that point, given we have seen so many go it alone in the past, and will you be disappointed if they do go their own way at that point?
Well, my disappointment won't be the issue. The disappointment of the Australian public will be the issue. See, we're living at a time now where the responses that are now being put in place, quick and hopefully short lockdowns, that's how you stay ahead of Delta until you reach these marks. At an earlier time, then it was different. And states like New South Wales had been in a position where they'd been able to manage it with their outstanding contact tracing and testing systems. But what you've seen from the Doherty's work is that when you hit 70% and 80%, and when you see from Treasury's work that those types of widespread actions can't be justified on the medical evidence and can't be justified on the economic evidence, then I think that is something that will inform, I think, the public's response. Now, at our meeting last Friday, there was strong commitment from all states and territories to this. And I note the comments of Mark McGowan. I believe he's been taken entirely out of context. And to be fair to Mark, because we speak a lot, at any stage, let's say we have a remote Indigenous community. The question came from this side of the room where there may be a population that is highly unvaccinated and therefore presents a real risk. Well, of course, if there's a problem, they'll have to take action. One thing that you don't do in a pandemic like this is pretend that you can know everything and that you take tools off the table. But the need for those tools, as the modelling shows and the evidence shows, is highly unlikely. Highly unlikely. And certainly once you get to 70 and 80%, I think that evidence is very clear. Now, what you've heard today, what the country has heard today, from the best expert evidence that you can get anywhere in the world, is exactly what the Premier's heard last Friday and Chief Ministers, and that my Cabinet has heard. And I think that information, that expert evidence, backs in our national plan to living with this virus. And of course, all Australians would expect Premiers, Chief Ministers and a Prime Minister to abide by that plan. I think it's a question of integrity and honesty with the Australian people, which I have no doubt that is taken very seriously by my colleagues on the National Cabinet. I'm going to go from the back and forward to Kieran. Yep.
Minister, on vaccine passports again, in France, millions of people signed up within a week of Macron's announcement, and the reality is that we still do have a fair bit of hesitancy among the community. Wouldn't making some kind of concrete announcement about what those passports might look like in the future act as a carrot for people who are eligible and hesitating or delaying? And is the reason the government hasn't perhaps pushed as hard for this as they could have because of the views of some of your coalition colleagues who are dead set against any form of vaccine passport?
No, I wouldn't say that. I remember when I first raised this concept some months ago when I was in Queensland. There were many views that are against it, and they weren't all in the parliament. Most of them are actually outside the parliament. Indeed, some of them were in the media. But my point is this. What you're raising is an important matter. At our meeting last Friday, we agreed in the plan, phase B of the plan, is that if you're vaccinated, you can be exempt from various restrictions that might otherwise apply because of public health reasons, because you've taken steps to protect your health and the health of those around you. If you're not vaccinated, you present a greater public health risk. And so this is about managing public health risks. That's what it is. It's common sense. It has the added advantage that, of course, if you are vaccinated, then being exempted from some of those restrictions is obviously an attraction. And that's why the Northern Territory, Victorian and Tasmanian governments are working together to bring back a proper list of options for the Premiers and Chief Ministers and I to consider, which go to the issues you're talking about. And yes, I agree, being able to articulate what they are is a good idea, but we've got to work through them and ensure that the states and territories are supportive of those, because they're the ones who have to do it. As a federal government, I can't restrict someone going or allow someone going into a sports stadium or a venue or even coming into this building. What has to happen is state public health orders to support those issues legally. Similarly, I can't make it the law for someone to require of a customer to declare their vaccination status or to make it compulsory for someone to be vaccinated. These things are done through public health orders at a state and territory level. So working together to define what they are is incredibly important. John Howard made a very good point on the weekend. The states don't have any more powers than they've ever had. They've just never been enlivened in the way that they have through this crisis. They've always had absolute control over public health in this country. But this once-in-a-100-year pandemic, I think, has shone a spotlight on that. And those powers are enlivened through that process, not through any other process. Yep.
I mean, so you just said Australians don't want to be paid off to receive the vaccine. Does that mean you'll be discouraging vaccine lotteries at any point in
We still remain open, and General, you might want to comment on this. We've looked at all of these, and General Frewen has already given you a comment on that. I think there's a big difference between something like that, a big difference, just not a fiscal one. I mean, the fiscal difference is pretty huge, I've got to say, and we've had lots of private offers of how things like that might work, and General Frewen and his team have looked at that. But the primary reason why Australians are going to do this is because Australians know that it's good for them, their family and their country. And I intend to respect that. I intend to acknowledge that, because that's what I've been backing the whole time, to ensure that Australians can come through in the way that we are. So we'll look at all of those issues. But to think that Australia needs to get paid off to do the right thing for their health, that's just not how Australians think. Because we have a very good vaccination history in this country. People do get it. We need to be careful to ensure that we follow an Australian way here, consistent with our values and our approach, because that's what has worked for us all the way through. And I'm going to keep backing Australians on that and believing in them and not issue a vote of no confidence in them. But General?
Look, we've had more than 12.6 million doses administered now. We're having record days nearly every day now, more than 1.1 million doses across a 7-day period. We're getting more than 200,000 doses a day on weekdays. We've had over 100,000 doses a day last Saturday. So Australians are coming forward right now. It's the right thing to do. It's important for the protection of all people in Australia. It's important for the nation to build the resilience we need going forward.
Over the back, and then
Yep,
time for a couple more. We're going to have to be out of about 5 minutes. Yep.
Prime Minister, just following on Claire's question on Gladys Berejiklian's 50% goal, Mark McGowan has attacked her over this, says that the 50% rate would be contrary to Friday's National Cabinet agreement. In your view, Prime Minister, would Gladys Berejiklian opening up after 50% vaccination rate be contrary to National Cabinet's Friday agreement?
Well, I think you're talking about two different things. They're two different things. We are talking in one instance about a national vaccination strategy where short, sharp lockdowns are the response during a suppression phase before you move at 70% into the next phase where that isn't as necessary or at all necessary, and certainly almost completely unnecessary once you get to 80%. That is a separate issue to how you come out of a lockdown you're already in. Now, coming out of a lockdown you're already in depends on the success of the lockdown in bringing the number of cases infectious in the community down to a level where they can be suppressed and contained. That is the goal the New South Wales Government is working towards. And when they believe they're in a position where they can confidently say they can do that, then I expect the lockdown to remain in place. So I think we need to be careful that we're not mixing two issues here. This is not a vaccination rate to break out of an existing lockdown. This is a vaccination rate that enables Australia as a country to move from phase A to phase B to phase C. So I think we've got to avoid sort of phony conflicts here. Paul, was there anything, did you want to add to that? Or no? Okay, I think we'll just keep going then.
So we've actually heard quite a bit from people who are struggling to get a vaccine appointment. In the cities and in regional areas, they're on the phone for hours trying to actually get vaccinated. Obviously, that's your aim here. Why is that happening? A software developer on the weekend managed to put together an aggregator of booking sites within the space of a weekend. Why can't the federal government do that?
That already exists, and General Frewen might want to speak, and there's that one. There's also one called hotdoc.com.au, which is also based on the engine that was developed by the federal government as well. So this already exists. It's already there. It's already there. But you make an interesting point about the fact that there seems to be strong demand for the vaccine. So when you have strong demand for the vaccine, I'm not sure why you have to pay people.
Yeah, so the eligibility checker refers you often to state and territory booking systems as well, and there is variance in the state and territory booking systems. We're working closely with the states and territories constantly to try and refine best practice across those systems. But I've also seen examples of next day bookings. I mean, there are many opportunities for AstraZeneca right now within days. So it is variable, but we're working to get it as consistent as we can.
You good, Kieran? Or?
Prime Minister,
Sorry, here there.
Question for Professor McVernon. Just in regards to the low-level restrictions that will start to be in place once we reach that 80% vaccination target, are masks included in that? In what kind of circumstances do you expect that people will continue to wear masks in Australia, and for how long for? And just a question, you mentioned that there would be a reorientation of strategy around the 20 to 39-year-old group. Can you elaborate a bit more on that?
Well, I might get General Fruin and Professor Kelly to talk about the latter point, but Professor McVernon?
So on the low restrictions, these are basically bundles of interventions that have been applied in Australia according to different strengths of coverage. And masks have or haven't been part of that strategy. Around the world, most modellers will not actually believe they can quantify the benefits of masks per se, because apart from anything else, a lot of important transmission occurs in households and people clearly don't wear masks there. But other than that, they are overlaid with other sets of restrictions. So the types of restrictions that we've described and consider in terms of the transmission potential are really around something where there are no stay-at-home orders, there are some social distancing rules and the 2 square metre rule, there'll be caps on numbers and in people in stadiums and workplaces and things like that. They're the sorts of settings that often we see as we come back out of lockdowns, of having still some level of spacing of people in the community, but without full lockdown. And masks are often an adjunct to that, and it's really impossible analytically to tease apart what masks contribute to that, but they're clearly important in helping people remember that there are threats out there and they'll be implemented according to public health orders at the time. Thank you.
The task was, as Professor McVernon has said, to come up with these bundles. That was useful for the Treasury modelling so that they could cost some of those things as well. And masks have generally become part of each of those modules, actually.
But it's not prescriptive, is the bottom. It's not prescriptive to that level in terms of your question. Sorry?
Of the strategy. That's what Professor McVernon said.
Well, on the 20 to 39, well, General Fruin may want to comment on that. I mean, one of the lessons through this process, as Professor McVernon indicated in her presentation, was that at the commencement of this program, it has been rightly the priority to deal with those who are most vulnerable in the community. And so whether it's been on aged care facilities and things like that, well, the fact that we've moved on that means that what we're seeing in Sydney is not what we saw in Melbourne last year. But as time has gone on, and we are increasingly confident as time has gone on, as we've gone into May and into June, about the impact of the vaccines on transmission, that now enables us to move to the next phase of the strategy and seek to bring more of those younger populations in sooner. And I'll ask General Fruin to comment on that.
Yeah, so look, I've developed a campaign plan which is really about managing supply with distribution nodes and then encouraging people in Australia to turn up to get vaccinated. That campaign plan is responsive to strategy. It also sits over events like hotspot outbreaks and those sorts of things. The shift in strategy here that's been spoken to, the idea that we do need to provide more focus on key transmissibility groups, that is absolutely able to be accommodated within the campaign plan, and we're looking to bring on 30 to 39s, which is the next highest priority as one of the key transmissibility groups from the end of this month, start of September.
PM, you said the Labor idea for a cash payment shows, or is a vote of no confidence in the Australian people, but is it really that big a departure from the no jab, no pay for parents when you've got a kid in childcare, or to get family tax benefit A, you've got to have your kid vaccinated. So already there's a financial incentive, and if you get to the end of the year where you can't shift that last 5-10%, why not? Would you be open to looking at an incentive like this?
Well, as I said, the incentives the government has been considered through Operation COVID Shield are matters that General Fruin has been looking at, but that it doesn't support cash payments of that nature. And no, I don't think there's an equivalence between those two. I know others have suggested that. And as the person who put that in place, I can tell you why we did it. We did it because we didn't want unvaccinated children mixing with those who were vaccinated for those conditions. It wasn't done necessarily as an incentive. It was done as a protection for those children who are in those childcare facilities. So there was a very different task. I mean, the social services lever was used in that instance to deliver on that outcome, which was very effective in protecting children from going into those childcare centres. Now, many of those who are very opposed to vaccinations, they just didn't put their children in childcare facilities. That's their right. That's their right. We already have a very high rate of child immunisation. So I wasn't seeking to massively increase child immunisation rates because Australia already has high child immunisation rates. It wasn't about increasing the rate. It was about ensuring that others didn't put those children at risk. And that's why we took that decision. So it is very different. I know that in other countries they think of other things, but I'll tell you this as we wrap up. Australia is making its own way through this pandemic with enviable success. We are going to be able, I believe, before we get to the end of this year, based on what is being achieved and what I've seen from Australians, to get where we want to go. And we're going to get there with one of the lowest death rates from COVID in the world, with one of the strongest economies in the world to come through COVID, and a vaccinated population that is achieving the marks that we wish it to achieve. And that is the triple gold that Australia is looking for. Thank you very much.